Well, Dr. Hooley, when we're dealing with neck and back injuries, there's things we just can't take lightly. I mean, everyone has had a stiff neck or a bad back occasionally, but when it goes on and on, they need to be checked out. And you guys here at Canyon View Orthopedic can handle everybody's needs. There's no need to go to Salt Lake. You and your team here specialize in this sort of stuff. Tell us about some of the things you deal with.
You bet. We deal with pretty much everything in regards to the neck and back, anything from a herniated disc or a pinched nerve to fractures, even up to complex scoliosis and revision surgery cases.
So all sorts of different things. And, you know, I know a lot of old farmers around the valley here who have suffered with these bad backs and bad necks for years. And, you know, they don't need to do that anymore. They can come down here, have you guys take a look at it, and really they can, you know, live pain-free.
Absolutely. No, we'd be happy to evaluate anybody and offer the latest techniques that we can to help them out.
Awesome. In a language that everyone can understand, what are some of the treatments that you guys do here?
Boy, we do lots of them. Anything from like a microdiscectomy, we can do that using minimally invasive techniques, to complicated decompressions and fusions, to reconstruct spines.
So anything from the very minute to the pretty intense there.
Absolutely. And we also, again, like to use the least invasive technique available. Just has to be used in the right situation.
Sure. And I you know, people who have these sort of problems are probably a little scared of, you know, going under the knife or doing surgery. But if you can use, you know, one of these different techniques that doesn't require surgery or maybe just some physical therapy, it's a lot better off for them.
Absolutely. Almost everything we like to treat non-operatively first. We don't usually like to jump into surgery. That's
Sure.
kind of our last result. But when it's indicated, surgery has very good results in the appropriate situations.
And do you find with a lot of the patients that come in here thinking, oh, geez, you know, surgery is my only way to get this out, you can find other ways to fix it and makes them a little more at ease?
Absolutely. In a lot of cases, there are some things we can do non-operatively, and for a majority of people, we can take care of things without having to resort to surgery.
And a lot of like sports medicine plays into this. You know, a lot of different physical therapy techniques are ways to treat these sort of injuries.
You bet. We use physical therapy a lot.
And you just had a new addition to your team. Talk about Dr. Jacob Egbert.
Yes, we're very, very excited to get him here working with us. We've got one physical medicine and rehabilitation specialist, and he will be our second. He will assist us greatly in helping people through non-operative care of neck, back, and any other extremity injuries.
And around the valley, you know, this is kind of a rural but an urban place as well. What are some of the typical injuries that you see on a daily basis? Or there be farming accidents, you know, someone lifting a bale of hay or a heavy box kind of threw the back out a little. What are some of the common things that you've seen?
Most commonly, I see people with severe leg pains, arm pains. They kind of radiate from either their neck or their back. Difficulty walking, those types of things. I see day in, day out.
And that brings up a good point. I mean, if the neck or the back is the cause of the pain, it just doesn't stay there. I mean, it affects the whole body.
Oh, absolutely. These kinds of problems can progress and they can be devastating.
And I'm sure this is kind of rewarding for you as well to see someone who's come in that's in such bad shape, goes through the process here at Canyon View, and, you know, leaves a whole new person, pain-free.
Yeah, that's the best case scenario. That's always good to see. It's those kind of outcomes are what you search for and what helps keep you going. So I'm always very happy when those happen.
And obviously that's the ideal. And, you know, some people may not have, you know, the total pain-free, but it is a lot better. I mean, it can't get any worse by coming here.
Absolutely, and I always tell everybody, you know, I can't turn them into an 18-year-old again, but you know, we can definitely make some changes, and they're almost always for the good.
Awesome. Well, let's talk about you for a minute. How long have you been here at Canyon View?
I've been here, almost 4 years, I think. Yeah, it's gone quick.
And are you from the valley, or did you transfer here?
No, I moved here from San Diego. Before that, I was in Texas. I actually grew up down in Utah Valley, but that was a long time ago.
Long time ago.
Yeah.
And now you're up here in Cache Valley. Well, what would you say to anyone out there who, may have that neck or back pain that's like, oh, I'll just take a few ibuprofen in the morning, we'll call it good. The next morning it's back again. They're afraid of doing the surgery, but there's a lot of options out there.
You bet. Each person we evaluate individually. We need to take into account all of the different pieces of the puzzle. I tell them I wouldn't be afraid. Like we said earlier, for most people, non-operative methods work. But when it comes time and in the appropriate circumstance, surgery is a good way to go.
Very nice. Well, tell people where Canyon View Orthopedics is located.
We are located at the south end of Intermountain Logan Regional Hospital.
There you go. So no need to live with that neck and back pain. Come on in and see Dr. Hooley here and the staff here at Canyon View Orthopedics. Why not live pain-free? You can do it here. Thanks a lot for your time.
Thank you. Appreciate it.